In this series of presentations, we're going to be looking at the conditions associated with the musculoskeletal system, and they include osteoarthritis, rheumatoid arthritis, and osteoporosis. But before we start, it's worth pointing out that there are approximately 140 arthritic conditions. Each one presents a little differently and may affect a different part of the musculoskeletal system. But let's start now with osteoarthritis. Osteoarthritis is a chronic condition of the joints, and it is usually associated with aging, occurring most often in people over the age of 40. It's commonly referred to as a condition involving the wear and tear of the joints. Those joints most affected tend to be the hands and the feet, but also the large weight-bearing joints like the hip and the knee, but it also can be found in the spine. So osteoarthritis can affect the entire joint, that's the bone and the cartilage, but can also involve the ligaments and the muscles of those joints. One of the most common symptoms of osteoarthritis is pain and stiffness. And there is generally tenderness and swelling of the joints, as you can see here. People with osteoarthritis often report a popping, cracking, or grating sensation on movement. For most people with osteoarthritis, the greatest difficulty appears to be movement after a period of rest, like getting out of bed in the mornings. Another characteristic of osteoarthritis are the bony spurs that often appear at bone ends and can be seen on X-ray. So let's look at the stages of the disease. In a healthy joint, you will see the cartilage here acting as a shock absorber during movement. So the first stage of osteoarthritis is this area here, the synovium, becomes inflamed, called synovitis. The disease then progresses to this loss or thinning of the cartilage, and that's the first stage of some of the restriction of movement. And then we see here the complete loss of cartilage and bone on bone and the presence of a bony spur. And this is where there is significant pain and that cracking and popping sensation that's described. And here you can see it more clearly in this illustration where the cartilage is gone and there is the presence of that bony spur. So let's look at some of the risk factors associated with osteoarthritis. As we can see here, it is a condition of aging. Women are more affected than men, but genetics can also play a part in the development of osteoarthritis. One of the key things that can contribute to its development is a previous joint injury where extra stress and strain is placed on joints. This is also a factor in excess weight with obesity and in those occupations where there is repetitive use of joints and loads placed on joints, which leads to some of that wear and tear and breakdown. In the early stages of osteoarthritis, the recommendation is to keep moving and reduce weight, and pain relief is one of the most common modes of treatment, as well as other therapies for reducing pain. But with the progression of the disease, as you can see here, hip replacements in blue and knee replacements in orange have become more common. And this graph shows the number of replacements done between 2005 and 2017. So this also reflects some of the aging population, that as people age, these surgeries are more common. And just looking at some New Zealand facts here, osteoarthritis, as you can see, is the most common form of arthritis in New Zealand, with 56% of those diagnosed with arthritis having osteoarthritis. As we said, it's more common in women, but also more common amongst Europeans. I just point out here that the data shown is raw data and it hasn't been adjusted as a percentage of the population. But what we can see here is that osteoarthritis is common amongst Maori. And that concludes our presentation on osteoarthritis.